Wrist extension, patient seated with elbow on table, hand in the air. Also, you can have the patient with their arm on the table and the hand hanging off the table, still able to perform full flexion and extension. So with this, just like flexion, we are going to measure with the axis on the triquetrum, the movement arm on the lateral aspect of the fifth metacarpal, and the stationary arm on the lateral aspect of the ulna. Go ahead and pull that all the way back from your range. Follow that, and we are looking at 70 degrees of extension with this. The alternative method of measuring extension is similar to the one that we did with flexion, except instead of being on the dorsal side, we're going to be on the ventral side of the wrist. So the stationary arm is going to be between the ulna and the radius. The axis, so for the axis, what you want to do is you want to find the capitate. So bend your arm forward, wait for that lunate to pop up, find the capitate next to it, lean it on back, go opposite, place that axis on there, and then line up the movement arm with the third metacarpal. So go ahead and extend your wrist backwards. Thank you. And right here, we're looking at 75 degrees.